Hi friends, in this video we are going to discuss how to optimally use procalcitonin, which is a very commonly used marker in the ICUs. We will learn details about procalcitonin as well as how to apply it in our clinical day-to-day practice and what are the limitations. To start with, how it is produced. So as you already know, it is produced by the thyroid gland, the neuroendocrine cells, and the actual product is calcitonin. Procalcitonin is actually a proform of calcitonin. Why we use it? So from our perspective, whenever there is a bacterial infection, bacterial endotoxin, bacterial exotoxin, or cytokines, certain cytokines of course, they lead to excessive release of procalcitonin within 2 to 4 hours, and this keeps on rising for next 24 to 48 hours, and the production keeps on continuing till the bacterial infection is going on. As soon as the bacterial infection subsides, the production of procalcitonin also comes down quite rapidly. So it in a way it correlates with the course of bacterial infection, and that's why it becomes a useful marker for us to use in this scenario. So that's about the physiology. You need to also remember that it is eliminated by the kidneys. So if there is any kidney dysfunction, the level of procalcitonin may not go down very rapidly, and you may not interpret it in the way we expect it to be. Okay, so now how can I apply it into my clinical practice? So I will take one by one. So I think there are four scenarios where we can see the application of procalcitonin. The first and most important one is community acquired pneumonia. So whenever there is severe community acquired pneumonia, you can with confidence you can use procalcitonin to stop antibiotic. So you need to be aware about ProHosp studies where they did a analysis of lower respiratory tract infection, which included various infections like community acquired pneumonia, COPD exacerbation, chronic bronchitis, and they found that when Procal was used as a tool to stop antibiotics, they could stop antibiotics 2.5 days earlier compared with the clinical or conventional method. So, and this at the same time, they noticed similar side effects and no change in mortality in both the groups. So, with confidence, you can use procalcitonin to stop antibiotics for community acquired pneumonia and to some extent other lower respiratory tract infections also. There was a Cochrane analysis in 2017 which said that you can use Procal to stop antibiotics, but you need to consider the clinical response, or if you have a viral etiology in mind, you can stop the antibiotics, or if you have diagnosed any non-infective condition, then also you can stop antibiotics based on your low Procal levels. Generally the usage is when the serial Procal, which is done every day or alternate day in these patients, when it falls to 80% or below from the initial level being more than 5 nanogram per milliliter, and if the initial level was less than that, when the serial Procal falls to less than 0.25 nanogram per milliliter. So this is the cutoff point where you stop your antibiotics. Another question is whether I can use procalcitonin to initiate antibiotic. So the short answer is no. But if your patient is clinically stable, no comorbidities, the laboratory investigation is pointing towards viral illness, and your procal is less than 0.25, then you may hold the antibiotic, the first dose of antibiotics, and observe the patient, and you may repeat a procal after 6 to 24 hours to see whether it is rising sharply, and that will determine whether you can start antibiotics or not. But in general, it is not a good practice to initiate or not initiate antibiotics based on your procalcitonin level. Another question that comes to mind is whether I can use Procal in ventilator associated pneumonia. So here also short answer is no. Because the patient is in the ICU, patient is critically ill, there are multiple problems going on with various systems involved, and procalcitonin can be high because of other systems or other problems also. So short answer is no. But if you can demonstrate an improvement in the trend of procalcitonin and at the same time you can demonstrate clinical resolution, maybe you can utilize Procal to stop antibiotics. But generally, it's not a recommendation. One more indication that comes to mind is whether I can use Procal for prognosis. So yes, to some extent, yes. In critically ill patients, I can use Procal to prognosticate. If the initial Procal is very high, probably the patient is likely to have a worse outcome, and probably the disease is severe. If my serial Procal levels are rising, that indicates that either my therapy is failing or the patient is worsening because of worsening infection, which indicates overall poor mortality. So yes, I can use Procal as a marker of prognostication in critically ill patients. So these are the uses and applications of Procalcitonin. Another study that you need to know is PROACT study, which was published in 2018 in NEJM. And in this study, they analyzed around 1600 odd patients in the procalcitonin group, where they used Procal to stop antibiotics in the emergency medicine, and around 800 odd groups in odd patients in the other group. And they found no difference in Procal in terms of less number of days for antibiotics, or in terms of side effects or mortality or anything. And this is rather contradictory to the whatever discussion we have had so far. But probably the limitation, I would say, is the adherence to the protocol, and in this study it was around 60 to 70%, which is not great. And statistically, even a small change in the numbers may change your outcome. So probably that would be the case, but definitely in my practice I use Procalcitonin in the way we have discussed so far, and I think this would be helpful to you as well. Now, the in the last, I think since we have discussed so much about Procalcitonin, I think we also need to know what are the limitations of the Procalcitonin. Limitations in the sense that when you cannot use Procalcitonin. So, there are certain conditions when Procalcitonin is falsely elevated. So, acute physiological stress, severe burns, severe trauma, severe surgery, cardiac arrest, brain hemorrhage, ischemic stroke. These are the conditions. Severe bowel ischemia, pancreatitis. These are the conditions where procalcitonin can be elevated, and there may not be a bacterial infection. So you need to keep this in mind. Sometimes the procalcitonin takes longer time to clear because of the kidney dysfunction. So you need to take that also into mind. There are certain other infections apart from bacteria. These are fungal infections and plasmodium infections, where sometimes Procal can get elevated. So this is also something which I want you to know. And the last thing is inflammatory autoimmune conditions. So I think except for Kawasaki disease, there is none autoimmune or connective tissue disorder where Procal is elevated. So barring Kawasaki disease, you can use Procal very well to rule out any autoimmune disease. So if Procal is high, it is likely that it is bacterial infection and not autoimmune disease or connective tissue disorder. So this is all about Procalcitonin. I hope you found this video useful. If you like this video, please hit the like button. Please subscribe to my channel, and I will try and come with more quality content in the field of critical care medicine. I hope you have a good day, and till the next video, goodbye.